Many people don't know that but body weight affects reproductive system, both male and female. Actually, body weight affects all of your body systems, but as I am OBGYN, I'm going to talk about reproductive system. It is so important to maintain a perfect body weight because it will affect not only the way you look, but also the way you feel yourself, and it will prevent some diseases in the future, and you can even prolongate your life. And of course, it affects your family because it affects your fertility. But what is perfect body weight? Is it a certain number? And how would I know what is my perfect body weight? And how would I know if I have a normal body weight? Well, for that, we need to know your body mass index, or BMI. BMI is a weight in kilograms divided by the square of height in meters. Now you can see a formula on the screen, so you can calculate your BMI. And also there are a lot of apps that could help you with calculating your BMI, so you can use one of them. If your BMI is less than 18.5, you're underweight. If your BMI is from 18.5 to 24.9, it's perfect. If you are between 25 and 29.9, you're overweight. And if you're over 30, you're obese. If you are overweight or obese, it could cause you a hormonal imbalance. And hormonal imbalance could be a reason of irregular menstrual cycle or ovulatory dysfunction, and it could lead to reduced fertility. If you are overweight or obese, it doesn't mean that you're 100% infertile, but it might be a little bit harder for you to get pregnant than for women with normal BMI. Also, obesity is associated with PCOS, which is polycystic ovarian syndrome. Not all women who has PCOS are obese, but many of them. And PCOS is associated with a low fertility. Obesity also has impact on fertility treatment. Obese women require higher doses of drugs which are used for fertility treatment. Also, their ovary poorly respond to fertility treatment, and they have less egg cells harvested. Also, fertilization rate is lower in obese women. If you're overweight or obese, you have an increased risk of miscarriage. Also, you have an increased risk of another complications. Preeclampsia is a high blood pressure combined with the presence of protein in urine, and it could lead to kidney or liver fail. Sometimes preeclampsia could cause seizures, heart attack, and even stroke. Also, it could cause problems with placenta and lead to preterm birth or C-section. Obese women who's pregnant also have a higher risk of blood clots. Another complication that overweight or obese women could have is gestational diabetes. It's a high glucose level in the maternal blood. Gestational diabetes could lead to a large baby and C-section, and large baby's shoulders could stuck during labor, and of course it's an increased risk of injuries both for mom and for baby. High BMI increases the risk of stillbirth, of birth defects such as neural tube defects, might cause problems with diagnostic tests like ultrasound exam or checking baby's heart rate during labor. After birth, a woman could bleed heavier than normal. If you're not planning pregnancy, increased BMI still affects you. Increased BMI leads to hormonal imbalance, and it could be a reason for endometrial pathology, like endometrial hyperplasia. This pathology could cause you heavy menstrual bleeding or bleeding in the middle of menstrual cycle, and this really affects life quality, and it can be a reason of anemia. And anemia affects not only the way you feel, but also the way you look. It can affect your hair, skin, nails, and endometrial hyperplasia is a risk factor for endometrial cancer. And now let's move to underweight people. BMI lower than 18.5 also causes hormonal imbalance, but in a different way, and there's a reason for irregular menstrual cycle, anovulation, and decreased fertility. I'm not really sure if you're interested in those mechanisms, and I don't want to bore you. So in this video, I won't tell about this, But if you would like to know more details about how your body works, write me in the comments down below, so I would add more of this information in my future videos. Underweight women who are pregnant have increased risk of growth restriction, preterm birth, and low birth weight baby. Weight changes might be caused not only by eating disorders, but also by hormonal problems. So, if your BMI is not normal, you need to make a doctor's appointment and get a medical checkup. Now when you know what is BMI and how it could affect you, you can find out what is your perfect weight and go for it in purpose to improve your health, reproductive function, and to prevent some diseases. And if your BMI is higher than normal, you need to lose only from 5 to 10% of your weight, and that's when you first might notice positive changes. And it should be even better when you reach your perfect BMI. This is a short video, but I hope it was helpful for you. Thanks a lot for watching. Bye!